The next presenter is Abiodun. Abiodun Folake is to present on the topic Influences of COVID-19 pandemic on breast cancer diagnosis and treatment in low supply locations, a case study of a tertiary healthcare facility in Nigeria. Over to you, Abiodun.
Good morning, everyone. I'm Abiodun Folake Abiola, Public Health Administration PhD students. So I'll be presenting on the topic of influences of COVID-19 pandemic on breast cancer diagnosis and treatments in low supply locations, a case study of a tertiary healthcare facility in Nigeria. COVID-19, Corona disease 2019, has been widespread at an alarming rate worldwide, and the tremendous load COVID-19 has placed on health systems has significant implications for cancer care. And to begin with, although data has sparse, patients with cancer appear to be more susceptible to infection-related complications, such as an increased requirement for ventilator support and increased fatality rates. Also, diagnosis may be delayed since the screening programs and the diagnosis services during the pandemic have been reduced in several nations. People fearful of infection have been less willing to even seek healthcare services. However, responding rapidly, healthcare professionals and management in several nations have reorganized cancer services and updated instructions for medical personnel and patients to limit the impact of COVID-19 on cancer care provision. The pandemic detrimental impact is most significant in low and middle income nations, where resources are scarce, infrastructure is inadequate, healthcare personnel and organized care teams are insufficient. Medical supplies during the pandemic and personal protective equipment are even low, and technology is scarce, resulting in a deficiency in the provision and delivery of critical care. If left unchecked, the pandemic access barriers to oncology care would exacerbate existing cancer preventative, diagnostic, and treatment gaps, ultimately worsening the region's total cancer disease burden and morbidity and death. As a result, this study aims to evaluate the influence of COVID-19 on breast cancer diagnosis in a tertiary healthcare facility here in Nigeria. And the methodologies of the study design included the use of breast cytology and histopathology data, which were extracted from Lagos State University Teaching Hospital, LASUT, in Lagos State. These data were also extracted to determine the trend and challenges of cancer diagnosis during COVID-19 compared to before the COVID-19 outbreak. The study location was in Lagos, and it was conducted at the State University Teaching Hospital here in Nigeria. And because of Lagos is the most populous state in Nigeria, the metropolitan area originated on island, including Lagos Island, protected from the Atlantic Ocean by sand spits. However, the city has expanded onto the mainland west of the lagoon, which with Ikeja, the capital of the state, and Agege over 25 miles northwest of Lagos Island. Lagos population is estimated at 21 million, making it largest African city. And the study population comprises medical professionals at LASUT, Lagos State University Teaching Hospital, including the doctors, the laboratory technicians, the laboratory scientists, the pathologists, the oncologists, and general medicine department. My sample selection was the existing data on breast cytology and histopathology from the facility were extracted to get information about the impact of the COVID-19 pandemic on breast cancer diagnosis. The sample size of this study is comprised of 36 respondents randomly selected from 3 departments in the facility. The data analysis after the extraction of the data procedure, the data was processed using the IBM statistic package for social sciences, version 20.28.0 for Windows IBM Core. And also the descriptive data included the respondents' socio-demographic characteristics and the impact of the COVID-19 pandemic has had on cancer diagnosis. Data were described as in percentage, in proportions, mean, average, and standard deviations, and presented as charts on the table that will be shown later. Inclusion, the study population and extension, the criteria, the pathologists, the technicians, the doctors, and scientists that work at LASUT are included in the study as well, while non-medical professionals and non-medical staffs at LASUT were excluded. The ethical approval was seeking, and before the study commenced, the commencement of the study, the authorizations were sought from the Lagos State University Teaching Hospital and the covered areas administrative and health authorities. Before participating in the study, the research team confirmed that all respondents willingly and with informed permission. Informed permission was established using signed consent forms securely stored with completed questionnaires form. The skill data collectors did each study with extensive experience collecting data in lawsuits. Additionally, all study supervisors and note takers received training on research ethics and consent processes. The results of the study. The socio-demographic profile of the study respondents are shown in table 4.1 that will be showing more than 3/5 of the respondents, that's 63.9%, 23 were male, 36.1% were female, half, that's 47.2% of the respondents were between 20 and 30 years, 36.1% were between 30 and 40 years, and 16.7% were between 41 and 50. All the respondents making at tertiary education. 66.7% were married and 33.3% were single. Most of the respondents, the 88.9% were Christian and 11.1% were Muslim. 16.7% were general medicine practitioners. 8.3% were health administrators. 3.3% were medical laboratory scientists. 11.1% were nurses. 5.6% were in oncologists. 11.1% were pathologists, and 13.9% were in physiotherapists. More than half, the 21. Thank you. Sorry for this. So most of the respondents, the 89.9% were Christians, and 11.1% were Muslims. 16.7% were general medicine practitioners. 8.3% were health administrators. 3.3% were medical laboratory scientists. 11.1% were nurses, and 5.6% were in oncologists. 11 were in pathology department, and 13.9% were physiotherapists. More than half, 58.8% of the respondents had 1 to 5 years of experience. Then 3.3% had 6 to 10 years of experience, and 8.3% had more than 10 years of experience. As I've said before, the socio-demographic profile of the study respondents, as I said earlier on, that the female frequency 13, that's 36.1, which I've explained before. This was the table to explain what I've said earlier. That age, they are 20 to 30 years, 17, and that's 47.2%. 31 to 40 years, 13, 36.1%, and the 41 to 50 years, 16.7%. Education, tertiary education, most of them have tertiary, and they are 36, that's 100%. Marital status, the married ones among them were 24, 66.7%. The single 12, 33.3%. Religion, Christianity, 32.32, 88.9%, and people that practice Islam were 4 and 11.1%. The general medicine, 16.7%, health administrator, 8.3%, medical laboratory science, 33.3%, nursing, 11.1%, oncology, 5.6%, pathology, 11.1%, physiotherapists, 13.3%. And they have 1 years of experience, 1 to 5 years, were for 58.3%, 6 to 10 years, 3.3%, and greater than 10 years was 100%. The graph also please, the graph is not that clear, but I can still, the graph is trying to show the effect of COVID-19 on the supplies of diagnostic materials, as shown in figure 4.3, when asked if they are experiencing a lack of proper supply of diagnostic materials supplied due to pandemic. 72.2% said yes, there was low supplies of PPEs, consumables during that time because of several cities were locked down, the skyscrapers were closed, and even 27.8 said no. You can see it on the graph. Analysis of breast data abstracted. Variation in breast sample diagnosis before and during the COVID-19 pandemic, as shown in figure 4.4 earlier. The total breast samples tested increased by 39, that's 8.2%, from 2018, that's 474 to 530 in 2019. However, the number decreased by 172, 33.5% in 2020 when the COVID-19 pandemic started with a 6-month lockdown. So in 2021, the total number of breast samples tested increased from 341 to 380, accounting for an 11.4% increase. The diagnosis results showed a steady decrease in breast benign from 237 in 2018 to 149 in 2021, representing a 37.1% decrease during the COVID-19 pandemic. Similarly, the malignant cases increased from 237 in 2018 to 277 in 2019, but reduced to 188 in 2020 and 231 in 2021. The study primary purpose was to investigate how COVID-19 affects cancer detection. The pandemic's interruptions to cancer services have been especially severe in low-resource contexts, such as many African nations and other low-medium income settings. According to Lombe et al. 2020, Trehan et al. 2020, it is extremely challenging for medical oncologists to continue meeting the needs of their patients and staff during this unprecedented epidemic, because preliminary data reveals that cancer patients may be at a considerably higher risk of COVID-19 related disorders because of the co-infection, because of their low immune system. So most of the participants in this research are males between the ages of 20 and 30. They have all finished post-secondary education and are married with children. In general, practice medicine and have been 1 and 5 years of experience. The selection process may contribute to the differences in socioeconomic status indices as well. Impact of COVID-19 on diagnostic processes. When asked how they were exposed to the risk of contracting COVID-19, most respondents, 88.9%, highlighted that their close interactions with patients during the cancer diagnostic process during the process reported a similar issues in their systemic review of cancer patients and career cares, which is consistent with the current studies finding. According to their findings, incomplete therapy, COVID-19 related issues, and the resulting consequences on participants' mental and emotional health were all sources of worry in the studies included in their mental analysis. As a result, cancer screening were discontinued, regular oncology appointments were cancelled, and treatment was postponed, all of which contributed to increased stress and worry, demonstrating a terrible lack of disaster preparedness. Facility breast samples diagnosis during the COVID-19 pandemic. The outbreak is expected to influence the diagnosis of breast samples. On the other hand, the findings of this study suggested that the great majority of laboratories, they stayed open during the pandemic and continued testing on breast tissue samples. According to Globasi et al. 2021 and Nagy, COVID-19 substantially influences diagnosis, which contradict their finding. Early detection programs have been halted worldwide because of worries about the spread of COVID-19 in healthcare settings. This effect is expected to be more evident in low-resource settings due to weak infection control strategies and resource constraints in providing personal protective equipment, cancer screening, and diagnostic services. So due to the pandemic, routine breast samples procedures have been postponed, even in Ghana and even in Nigeria and several African countries. Most medical services were suspended during the pandemic. To minimize the spread of COVID-19 virus and decrease demand for medical services, cancer patients are frequently encouraged to delay or postpone treatment, and hospitalization was discouraged. However, this can be hazardous to patient health, since delays in cancer diagnosis or treatment have the potential to negatively impact patient outcomes, such as the cancer chance of a late diagnosis, the spread of the illness, and the progression of a tumor from treatable to incurable. Effect of COVID-19 on the supplies of diagnostic materials and availability of personal protective equipment. The participants in this research, they overwhelmingly blamed a lack of diagnostic equipment and personnel at the clinic during the outbreak. And also, there were wide discrepancies in how many PPEs were thought to have been available at any one time during the pandemic. When asked about the availability and quantity of personal protective equipment, some respondents felt it was inadequate, while others felt it was fair or suitable. A rise in demand resulted in a shortage of PPE, which increased cost and reduced supply. Perhaps this is the result of travel bans that have hurt the economies of many nations. Similarly, similar results were found by COT 2020, when they investigated healthcare supply bottlenecks. Amid the widespread of COVID-19, Court et al. 2020 claims that the COVID-19 pandemic has wreaked havoc on the global healthcare supply chain, leading to a scarcity of raw materials and significant price hikes. That's because this explains the worldwide grounding of aeroplanes and the prohibition of cross-border travel and cargo have seriously disrupted the global transportation of infrastructure. So according to Reynolds findings, in 2020, the global supply chain has been significantly disrupted by the 68 nations that have banned shipments of personal protective equipment supplies owing to the pandemic. Variation in breast sample diagnosis before and during the COVID-19 pandemic. The finding of this study demonstrated substantial changes in the diagnostic accuracy of breast cancer samples collected before and after the COVID-19 outbreak. There was steady growth before the outbreak, despite more samples being analyzed before the pandemic commencement in 2020. Similarly, there was a 37.1% decrease in benign breast diagnosis throughout the outbreak. Malignant cases also declined throughout the pandemic, matching the trend seen before and after the pandemic. The lockdown may have deterred breast cancer women from obtaining medical treatment, explaining this disparity. People's unjustified fear of contracting the virus may add to the disparity. According to Laurie et al. 2022, report that declines in cancer diagnosis during the pandemic were primarily due to declines in screen-detected cancers, which was consistent with previous work. And that shows the pandemic had a greater impact on screening than diagnostic breast imaging. Although monthly screening levels recovered to normal by the summer of 2020 and recently missed mammography exams earlier in the pandemic would demand higher than average imaging volumes to compensate for the shortage in cancer diagnosis. So according to Angeline et al. 2022, cancer screening and diagnosis were among the several medical services that had to be altered owing to the limitations imposed to battle the pandemic. As a result, fewer cancer testing and detection will be performed during the outbreak. It is the result of their inquiry. Cancer diagnosis and diagnostic tests exhibited a U-shaped declining trend during the pandemic, with a negative peak in April 2020, when most governments around the world instituted quarantine measures to limit this disease. Angeline discovered that the number of cancer diagnoses decreased by 37.3% between 2020 and 2022, while the number of diagnostic tests decreased by 27.0%. And the limitations, it is impossible that this finding of this study are not reflective of the breast cancer population as a whole in Nigeria, because this study focused primarily on the influence of COVID-19 on breast cancer diagnosis and was carried out in an environment with limited resources. And consequently, further research ought to study not just larger regions, but also the impact of COVID-19 on breast cancer patients, such as those genetically susceptible to mental illness and clinical depressions. In conclusion, this study analyzes the effect of the COVID-19 pandemic on breast cancer screening in low-resource nations. Our finding shows that a shortage of medical staff frequently causes increased patient volume due to lack of willingness to show up to work or a lack of proper medical equipment, lack of personal protective equipment, fear of catching an illness, high prices, and inexperienced inhibited healthcare providers and patients. As a result, it is crucial to furnish the healthcare industry with adequate funds, personnel, and even pandemic preparedness and supply to suit the needs of patients and staff. In addition, information exchange and coordination among healthcare practitioners are vital for delivering high-quality patient treatment and decreasing workloads. Conflict of interest, there was no conflict of interest during the research. Thank you.